As you know, there's been a number of pieces of legislation that we've been discussing from the introduction of when we started session, and two of the pieces were very important to what's going on up here in Chestertown. The first bill was a co-sponsor of myself and Senator Rosapep from Laurel, Maryland, and that had to do specifically with initially the closing of the hospital and the process on which the closing could or could not take place. That's the one that we'll be hearing next week as well, and I know a number of you are coming down to talk about that. The next piece of legislation was basically the vehicle that would allow what was being looked at here at Chestertown, and that's to eliminate inpatient services. And what they were calling that was a freestanding medical facility, going from an acute care hospital to a freestanding medical facility. And Senate Bill 707 was the vehicle that would allow that to happen. I have to admit, from the delegation's perspective, this has been the most important issue that we have been working on in Annapolis since the day that we got there. In fact, I was telling Commissioner Short this morning when I talked to him, there was a photo of me in the first day of session, and I was talking to the chairman, and we were literally talking about this hospital and what this meant to this community on that morning when we first came in here. So we have had several meetings. The delegation has all participated in these meetings with regards to what may happen to Chestertown in the process. I'm going to let Mac talk a little bit about, or a lot more about, the specifics to everything on why some things have to happen and why things are going in a certain direction. But the reality is Senate Bill 707, what we're going to do now as a result of everybody being involved and making this a big issue is we're going to eliminate the Eastern Shore from that bill. So a freestanding medical facility, we could not go from an acute care to a freestanding medical facility once this bill is amended and passed. So that is a huge victory here for Chestertown. And as we say a lot of times, we bring legislation down to draw attention to issues. A lot of people were involved in the windmill bill that we had last year in front of our committee as well too. And while we didn't get that specific bill passed, we got the desired outcome out of that. And Senator Middleton was very instrumental in helping that happen as well too. So I'm going to let Mac talk a little bit about how we're going to go forward. There's again a much broader issue that he's going to discuss about the delivery of healthcare services in a regional or in a rural community, and that has been the focal point of what we've been able to talk about in every single argument or meeting that we have been in as a delegation, to say that you just can't keep treating rural counties the same way as you're doing other counties. And I think that was the message that was conveyed the most when you've had a series of meetings. So I want to thank Mac for coming down here, and I especially want to thank all of you for keeping the pressure on. Commissioner Short, Commissioner Fithium have been very instrumental in keeping us updated on the feel of the community from everybody, and my delegates have done an outstanding job of keeping the message strong over in the House as well too. And I'll add that to their credit as well, Chairman Pete Hammond, Delegate Hammond, was in the meeting with us last night as well too, and Chairman Hammond is the chairman of Health and Government Operations and has the same issues or same subject matter as Senator Middleton does in the House, and he is one of the signatories of this bill, of this letter as well too. So this has truly been a collaborative effort from both sides of the both chambers. And
Mitchell.
That's right. We also, part of our meeting last night, we wanted to make sure that the executive branch was represented in this agreement as well too. And short of the governor signing it, there's nobody higher than the Secretary of Health that got on board with this and recognized that we have to address the delivery of healthcare services in the rural county as well too.
I would say to you that a lot of times there's a silver lining behind the dark cloud, And I know my Senate bill was probably perceived as a dark cloud, and let me tell you why. First of all, I'm a sponsor of the bill. As chairman of the Finance Committee, we have all the health-related issues. And there's something that's very, very important to the state of Maryland, and that's the Medicare waiver. I'm sure most of you all know about the Medicare waiver. But when you look at the dollar amount to have in the Medicare waiver, we're the only state in the whole entire country that has it. And what it means dollar-wise, it's about $1.8 billion that comes into the state of Maryland. And we just went and got a new federal waiver, and it's changed the paradigm of how healthcare delivery is made in the state of Maryland. Rather than just a unit of service, you get X amount of dollars. The new paradigm is you get rewarded for outcomes. And for hospitals, the biggest test that they use for performance is readmittance. And I will say to you, it's probably the best thing that ought to be done for healthcare. Hospitals have to have a responsibility when they send someone out of their doors, when they leave the hospital, to make sure that they're properly placed, that they're getting the proper care that they have. That was the first part of the Medicare. The second piece of Medicare has come about now, where it requires a lot of the services that are in the hospitals to be placed into the community. And that seems to be a big challenge, but as we said last night, that can be a wonderful opportunity that you start taking services and bringing them to the community. I introduced a bill because of the Medicare waiver, we have to look at how things are done. Right now, a hospital can shut down without any notice whatsoever. They can just shut down. That's not the right way to do. That's not the right way to do. And I will say to you, the silver lining behind the dark cloud is that whole entire thing has brought this community together, that you've really come out and voiced your concerns about what it means to potentially shutting a hospital down and what that means, especially for people that are elderly and whatnot. What does that mean when I don't have a hospital, my community hospital? So what has come out of this whole entire thing is looking at this and examining it and coming to the realization that we need to look at coming up with a whole new different healthcare delivery policy for the rural areas. We have the hospitals situation here, but we also have the one in Laurel. Hospitals shutting down in Laurel is one thing, and they're just like you. They don't want their hospital shut down, but they do have access to hospitals right in their area. As a matter of fact, we're getting ready to, the state's investing, Prince George's County is investing in a brand spanking new hospital that's going to be 5 miles from where Laurel is right now. Completely different situation here. So after listening to all of this, Delegate Hammond and myself said, we really and truly need to move forward. Rather than taking this issue up, now let's take this issue off the table. Let's take it off the issue altogether, move forward with the other piece of it. But it shouldn't stop there. Where we want to go from here is that we want to take and put together a process that we look at this whole entire healthcare delivery for the Eastern Shore, for the rural parts of the community. And, what we need to look on is how do you maintain top quality? How do you look at keeping healthcare affordable? But just as important, how do you maintain accessibility? So the process that we've just put together skeleton. We're going to work with your representatives in Annapolis to put the flesh on the bone, to identify just exactly what the process is going to be. I will assure you, Delegate Hammond wanted to be here. He couldn't be here tonight. It is going to involve everybody, the stakeholders that are needed to really and truly come up with this whole entire delivery plan. So it's not going to just stop. We're going to take the Eastern Shore out. We are going to take it out, but we're going to put together a process that we really and truly address what the healthcare needs are. We've made it very clear. OMS has made it very clear. They've given us their commitment that they're not going to be shutting down any hospitals. I think they're coming to the point right now. We need to look at this thing differently. I mentioned the Medicare waiver. I think if we do this right, what's happening here is happening in every part of the country. Rural hospitals are just being shut down one after the other. And they don't have a Medicare waiver like we do. They're being shut down because of the cost of healthcare delivery, the need for efficiencies and whatnot. We have an opportunity we have an opportunity, if we do it right, to become a national model of how you address healthcare delivery in rural areas. We have the opportunity, we have the resources, we have something that they don't have, and that's $1.8 billion that comes into our hospitals that we can't afford to lose, that we can take and come up with, I think, what is going to be a very, very good plan. That's going to involve the community as we put it together. So,
or Sure Health Systems never suggested they were going to close the hospital. What they suggested, or we think they have suggested, although we don't have it in writing, they were going to close the inpatient beds, and they have continued to cut back on our services. Is this bill going to not allow them to close the inpatient part of this hospital?
they have stated they're not going to close anything down until we finish this
Anything
process.
means inpatient bed. I just want to be sure, because the devil's in the words. I mean, they have said they will not close inpatient beds at the Chester River Hospital.
That hasn't been part of our discussion. It certainly will be. I'm pretty sure what they meant is they're not going to discontinue anything. This thing is going to be left where it is until we go through the process. But what we're looking at is we want the process to be done right. We're going to identify who is a proper facilitator, because bringing a community together with stakeholders, you have to have the right entity that's going to be leading this whole in charge. That's what we're going to have to identify. Our hope is that we have something in place. A lot of this is going to require legislation. So in my mindset, it's something that we want to do in the interim. That's between the time we end the session this year and when we start the session next year in January. So that's a time frame that we're looking at, that I think gives us enough time, because it's going to take a lot of time. So it's going to take a lot of meetings with people. You're probably going to have various subgroups that work on particular issues. So I think probably those 9 months will be an adequate amount of time to do that. I think if you think this is the right process, if you think this is the right way to do it, we would love to hear from you. We'd love to hear from you. And as the chairman of the committee that has all these bills, there's so many other bills that have to be heard, it's pick your panel of your spokespersons that you want to give to testify on your behalf, and then come down and show support for those people that are making the presentation. That would be the ideal one.
Because I don't want to hear the same thing I heard from Cozell, saying we're going to study the process and we haven't decided yet what we're going to do. We'll let you know a few months from now. I prefer not to hear that same.
But I will assure you, it isn't going to be UM's process. It's going to be our process. There's certainly a stakeholder in this. They're going to be part of the process, but it's not their process.
It's open instead of how can we deliver health care.
Way I see it unfolding is we're going to come up with a plan that best addresses the needs of rural hospitals and rural healthcare delivery. I don't know if it means keeping inpatient beds. I don't know if it means consolidating hospitals. I don't know. We're going to arrive at that if we do the process together, and it's our plan. That delivers the best quality, the most affordable, the most accessible health care. That's the end game. And I don't know what the plan's going to be. We have one with our delegation, your delegation. And then I had a separate meeting to bring in the Health Service Cost Review Commission, the Maryland Healthcare Commission, because they do all the planning and whatnot, to explore some possibilities. And it came down to Delegate Hammond, Van Mitchell, and myself saying, we just need to take this off the table. It needs to be taken off the table, and we need to regroup. And actually, UMS was the one that came to us and said, rural hospitals are shutting down everywhere. We have to maintain hospitals. We have to look at this whole entire axis. We need a policy that addresses just rural healthcare delivery. You don't have to worry about it in Baltimore, but rural areas, you have to address it. And actually, they were the first one that came up and says, we need to have a whole rural healthcare delivery program, a plan. And so the next step, and I said, look, one of the things is that the whole trust issue, the Eastern Shore community, there's a real trust issue, and they admitted that. And so it's not that I didn't want them here and whatnot, but you had to hear from people like myself and Delegate Hammond would have been to give you the assurances. We're going to work with your delegation to put a process together and what we're going to end up with is going to be a very, very good comprehensive product.